Hey guys, welcome back. Episode number 6. We're now continuing our mobility orientated theme. You see in the last episode that we talked about the front of your thigh and the anterior part of your hip being mobilized, and by now you're probably realizing that there's quite a bit of work to do in that area, but that's normal, so don't lose heart on that, just keep working at that one. Today we're going to talk about a very important accompaniment to the last one. Having spent a lot of time with tightness through the front of your hip, we often find that there's a corresponding amount of tightness through the lower part of the lower back with most of our patients and athletes. Quite simply, we are going to talk about stretching off this region, but because of its location, it's quite a difficult region to actually access without the use of some additional tools and toys. So for the purpose of this video, and for one other video coming up, we're going to ask that you try to get your hands on a hard ball. A hard dog ball is suitable. This is a lacrosse ball. A hockey ball, for example, is also fine. Just something that you're going to use to bias the stretch to the area where we want it to be. Stretching, of course, can be quite tricky, and your body's very clever, so when you stretch, the bits that are tight don't always move. The bits that aren't tight do most of the moving, so sometimes you have to use some tools in order to facilitate that better. Now, for the purpose of this exercise, we are talking about mobilizing a soft tissue which sits in the pocket of the lower back, just above the hip bone, right, quite close to the spinal bones in the back that you can feel on yourself, but about 3 or 4 or 5 inches out from the side of there, depending on your stature. Now, the area we want to be in is around about here, and you'll see that in a moment when I'm on the floor. We don't want the ball to get too high up under the ribs or on the lower ribs, because there are some organs underneath there which are not going to take kindly to being poked and prodded. So you're going to spend time more towards the bony bit on the hip than up towards the ribs. So for the purpose of this, you're going to need a floor mat and a space again, and we're going to start off on our backs, and I'll start off here with the ball in our hand. Now, if I'm going to stretch off or work on the left hand side of my lower back, I'm going to first of all reach my left arm up in the air and my left leg down towards the floor, and then I'm literally going to roll over onto my left side. Now in this position, having my leg and my arm extended means that I'm winding up the soft tissue on the outside of my body, which makes this technique far more effective. With my free arm, I'm going to pop the ball under the base of the lower part of my back, just in and around the soft tissue-y bit that you can feel there. You don't have to worry about being completely accurate, because you will know when you're in the right spot, and this might take a little bit of fiddling with to get in the right place. From here, I'm going to keep my hip and my shoulder together, and I'm going to roll them backwards until I feel that I accept my weight onto the ball, and I can feel the ball digging into the soft tissues in my lower back. For some of you, this will be uncomfortable enough to be in this position. For those of you that need to push it a little further, you're going to put your free arm on the back of your neck, and you are going to continue to drop your shoulder blade down towards the floor over the ball, until you feel as though the intensity level of the stretch reaches a level that you're satisfied with. You'll stay here, and the objective of this exercise is to literally wait until the intensity of the technique reduces. The ball causes a local stretch because of the contour of the ball. It causes a local stretch in some of this tricky position soft tissue. It's going to feel like somebody put the thumb into your back, which at first can feel quite uncomfortable, and on our same scale of 0 to 10, it's probably going to get up to around about a 7 again, and the objective here is to wait until that intensity drops off. We normally recommend to our athletes that that intensity reduces to about a 2 or a 3 out of 10, and then that's an indicator that the necessary release has been achieved. You can then reposition the ball within a few centimeters, and you may find a second spot is equally as tight as the first one was. And you can spend time in each area repositioning the ball as many times as you feel necessary to feel like you've achieved the objective, which is to basically release that area. Once you've done this, it's quite nice that we then ask the body to use the movement that you've just created. So quite simply, you can have a little lie on your back on the floor, and once you've loosened it off, you can literally bring your knee up and you can do some big knee hugs with each leg. And this just is a really nice way of opening up some of that soft tissue. You can even come to your feet and stand up and just literally practice bending over towards the floor and generally moving your back through different planes of movement, so the tissue that you've just loosened off understands why it's being loosened off, which is to allow normal movement. We generally find that the hip stretch from the last video and this ball exercise work fantastically well together, and you may well find that you end up doing one and then the other as a little group of exercises together. This is very uncomfortable, but provided you stay down towards the bony bit on the side of your pelvis, it's very safe, very effective, and can help significantly with some ongoing grumbly lower backs. But also, more importantly, allow you to keep good position of your pelvis and allow some of those stability exercises to be even more effective.